So Changing Futures is testing new ways to support people who are experiencing multiple disadvantage. And that means they might be receiving support from a number of services for overlapping needs. So things like poor mental health, substance misuse, homelessness and rough sleeping, contact with the criminal justice system, or experiences of domestic abuse.
Changing Futures done all the hard work for them, for me to live, for my daughter to live with me. Because if it wasn't for Changing Futures, my daughter wouldn't have been able to live with me, and they would have had to rehome her somewhere, again, costing people money.
Changing Futures want to change the system that's not coordinated, and it's got to be brought together to say, let's work together. Client with 6 needs, the 6 needs could be different agencies. Those agencies need to sit around the table and talk.
There are around 336,000 people with multiple disadvantage in England, and we know the system just doesn't work for them at the moment, which can lead to people falling through gaps and really high costs for public services. That means poor outcomes for individuals, for their health, their well-being and their opportunities, and high costs for public services. On average, a person with multiple disadvantage costs public services 5 times more than an average citizen. The government's investing £10 million next year, supported by £5 million too from the National Lottery Community Fund, to continue supporting people through Changing Futures. And we'll be looking at how Changing Futures can deliver on the government's missions and learning more about how Changing Futures can make public services work better for people that need that support, particularly for people experiencing multiple disadvantage.
6-month period of Changing Futures work with social services, she can live with you. That is the difference that Changing Futures has done. Not only taught me how to live sober, they've enabled a child that was at risk to come back to her mum, and gave ongoing support to enable that to happen without me relapsing. And that's the impact, I would say. That's quite an impact.